Hello everyone, welcome to Bit of Anatomy. In this tutorial, we will see the features of the interior of the cranial cavity in the base of the skull region. So in this, the top portion of the skull, that is the calvaria, has been removed. So if we study the interior of the cranial cavity, so before proceeding with that, we see this part. So this is the cut section of the bone. So this part is called as the outer table. So this is known as the inner table, and this intervening area, it is called as the diploid tissue. So this contains the diploid veins which drains the venous blood of this region. And anteriorly, if you can appreciate here in the frontal bone, we can see some deep openings here. So this represents the frontal air sinus. And if you see the thickness of the bone at this region, that is at the temple region, so the bone is quite thin. So the bone will be thin where it is covered by the muscles. So this region is the temple region, the temporal bone part. So if you see the interior, so we study the interior under three subheadings: the anterior cranial fossa, the middle cranial fossa, which is deeper than anterior, and the posterior cranial fossa, which is much more deeper than the middle cranial fossa. So in the anterior cranial fossa, it is bounded posteriorly by the sharp border which is formed by the lesser wing of the sphenoid bone. So you see the bones that are present in the anterior cranial fossa, it contains this irregular bone, the orbital plate of the frontal bone, and in the central part there is cribriform plate of the ethmoid bone, and this posterior part, it is formed by the parts of the sphenoid bone. So this frontal orbital plate of the frontal bone, it shows many elevations and depressions. So these elevations and depressions, it lodges the corresponding depressions and elevations of the frontal lobe of the cerebrum. So in the central part, we can see here one prominent crest, which is known as the frontal crest, which provides attachment to the false cerebri. And this is the cribriform plate of the ethmoid bone, so which will be perforated throughout for the passage of the olfactory nerve. So this separates the anterior cranial fossa from the nasal cavity, whereas the orbital plate separates the anterior cranial fossa from the orbital cavity. So in the lateral margins, there will be anterior ethmoidal foramen, so which is not very much clearly appreciated here. Here we can see one, the anterior ethmoidal foramen, which transmits the anterior ethmoidal nerves and vessels. And posteriorly, there is posterior ethmoidal foramen, through which the posterior ethmoidal nerves and vessels will pass. So in the central part, we can see this elevated area of the bone. So this bone, it is called as the crista galli. So it provides attachment to the anterior most end of the false cerebri. So in between the frontal crest and the crista galli, so there is a foramen called as foramen cecum. So this foramen, if it is patent, it transmits a vein from the nasal cavity which communicates or which opens into the superior sagittal sinus. Posteriorly, the cribriform plate of the ethmoid bone, it joins with the jugum sphenoidale, a part of the sphenoid bone. Whereas laterally, this orbital plate of the frontal bone, it articulates with the lesser wing of the sphenoid. So this lesser wing of the sphenoid, it partly forms the roof and partly forms the covering of a fissure called as the superior orbital fissure, and posteriorly it has got a sharp border which lodges in the lateral sulcus of the cerebrum. So if we trace this lesser wing of the sphenoid bone medially, it ends in a process called as the anterior clinoid process. So these are the features in the anterior cranial fossa: the orbital plate of the frontal bone, ethmoid, cribriform plate of the ethmoid, the crista galli, frontal crest, foramen cecum, jugum sphenoidale, and the lesser wing of the sphenoid bone and anterior clinoid process. Next, if we see the features of the middle cranial fossa. So in the middle cranial fossa, so it is almost butterfly shape. So this appears like body of the butterfly, and these parts appears like the wings of the butterfly. So it is mainly found by the various parts of the sphenoid bone. So this region is found by the body of the sphenoid, and this is found by the greater wing of the sphenoid bone. So in the median plane, if we appreciate, so this depression, slight depression here, it is called as the sulcus chiasmaticus or the optic groove. Above this, there will be situation of the optic chiasma. It will not be situated inside the sulcus. So laterally, if we trace that sulcus chiasmaticus on either side, it leads into a canal, so which communicates with the orbit. So this is called as the optic canal. So through this optic canal, the optic nerve and the ophthalmic artery will pass. And if we see the remaining region in the median plane, so this depression here, it is called as the pituitary fossa or sella turcica, so which contains diaphragma sellae anteriorly, the hypophyseal fossa which lodges the pituitary gland, and the dorsum sellae, so which has got damaged in this. So this dorsum sellae on either side, it presents a projection which is called as the posterior clinoid process, whereas the diaphragma sellae on either side presents a projection. I'm not sure how much you can appreciate this. So this is the called as the middle clinoid process, so which is connected to the anterior clinoid process by ligament, and sometimes it is completely ossified. So in the pituitary fossa, of course, the hypophysis cerebri or the pituitary gland will rest. So inside this, so there will be sphenoidal air sinus. So here we can see one cut portion of the bone forming the sphenoid of entering into the sphenoidal air sinus. On either side of this pituitary fossa, so we can appreciate a small depression here, so which begins from this foramen called as the foramen lacerum, and it passes on either side of the pituitary fossa in the upper part of sphenoidal air sinus. So this allows passage of the internal carotid artery. So internal carotid artery enters through the upper part of the foramen lacerum. So it passes through this groove. It winds around here again to form the carotid siphon and lies above the cavernous sinus. So this is the region of internal carotid artery. So on either side, if we appreciate the greater wing of the sphenoid bone, so anteriorly, this greater wing of the sphenoid bone, it forms boundary of this large fissure, so which communicates the middle cranial fossa with the orbital cavity. So this large fissure, retort-shaped fissure, so this is known as the superior orbital fissure. So this superior orbital fissure, it is divided into medial, lateral and intermediate parts by the presence of a tendinous ring which provides origin to various extraocular muscles of the eyeball. There are various nerves and vessels passing through various compartments of the superior orbital fissure. Through the lateral part, the lacrimal and frontal branches of the ophthalmic division of the trigeminal nerve, the trochlear nerve and superior ophthalmic vein will enter and leave through the orbit. Through the middle part, the upper and lower divisions of the oculomotor nerve, the nasociliary nerve which passes in between the two divisions, and abducent nerve will pass through the middle part. Whereas the medial most part, it transmits the inferior ophthalmic vein. So these are the structures passing through the superior orbital fissure. So just behind the superior orbital fissure, if we appreciate, we can see a small opening there which is called as the foramen rotundum. So through this foramen rotundum, the maxillary nerve will pass and it will enter into the pterygopalatine or pterygomaxillary fossa. So in the semicircular shape, semilunar shape, if we appreciate, there is foramen ovale behind the foramen rotundum. So this allows passage of four structures, which can be remembered is the mnemonic MALE. So M stands for mandibular nerve, A stands for accessory meningeal artery, L stands for lesser petrosal nerve, and E stands for the emissary vein. So behind that foramen ovale, we can appreciate one more minor foramen, that is the foramen spinosum, through which nervus spinosus, a branch of the mandibular nerve, and the middle meningeal vessels will pass. So if you see rest of the surface, it is irregular to occupy the various sulcus and gyri of the cerebrum, and starting from this foramen spinosum, we can see a depression here, so which again divides into an anterior part and a posterior part. So this lodges the middle meningeal vessels. So this lodges the trunk, this lodges the anterior or the frontal branches, and the posterior one lodges the posterior or the parietal branches. So these impressions, they are basically created by the middle meningeal vein and not the middle meningeal artery. And if you see this anterior surface of petrous part of the temporal bone, which forms the posterior boundary of middle cranial fossa. So over this region, turn it a bit. So if you see the features in this region, so it has got a apex, so this is the apex part, so where we can see a small depression called as the trigeminal impression, so which allows the passage or which lodges the trigeminal ganglion. So anterior to this there is foramen lacerum, so which in recent stage is closed by the fibrocartilage, and the upper part of the foramen lacerum, it allows passage of the internal carotid artery. So next we can see a small groove here. So a small groove which extends towards the foramen lacerum. So this groove, it lodges the greater petrosal nerve. So there will be a similar hiatus or groove, so which extends towards the mandibular foramen. So not very prominent in this. So that groove, it will allow the passage of the lesser petrosal nerve. So two hiatus, one passing towards the foramen lacerum, one passing towards the mandibular foramen for the passage of greater petrosal nerve and also the lesser petrosal nerve. So behind that, we can see a small elevated area, so which is known as arcuate eminence. So this arcuate eminence, it is produced by the superior semicircular canal. Whereas the remaining part of the bone here, it is called as the tegment tympani, which forms roof of the tympanic cavity. So these are the major features in the middle cranial fossa. So in the medial plane, we can appreciate the sulcus chiasmaticus, the diaphragma sellae, the hypophyseal fossa, dorsum sellae. So and the optic canal, the superior orbital fissure. So this is the impression for the carotid artery. So in the lateral part, we can see two bones, the greater wing of the sphenoid bone, the petrous part of the temporal bone, and this part is formed by the squamous part of the temporal bone. Superior orbital fissure, a large retort-shaped foramen here, foramen rotundum, foramen ovale, and foramen spinosum. So over this region, we can appreciate the trigeminal impression, the hiatus for the greater petrosal nerve, the hiatus for the lesser petrosal nerve, the arcuate eminence, and the tegment tympani. So these are the features in the middle cranial fossa. If you see the features of the posterior cranial fossa, it is much deeper than the middle cranial fossa, and it is the most larger one, since it accommodates the cerebellum posteriorly, and in the anterior part the medulla oblongata and pons are situated. So anteriorly it is bounded by petrous part of the temporal bone, whereas posteriorly by the occipital bone. So we see the features in the median plane. So there is this sloping surface which is called as the clivus, which leads into the foramen magnum. This sloping surface, it is formed by fusion of basi-occiput and basi-sphenoid. Then there is foramen magnum, which has got a narrow anterior part and a wider posterior part. The anterior part, it allows the passage of apical ligament, cruciate ligament, upper band of the cruciate ligament, and membrana tectoria. Whereas to the remaining part, the medulla oblongata continues as spinal cord. All the coverings of the spinal cord will be present. So the spinal root of the accessory nerve, the anterior and posterior spinal vessels, the vertebral artery will pass through the posterior part. And if you appreciate in this region, so this is the jugular tubercle. Above this jugular tubercle, in junction with the petrous part of the temporal bone, we can see this jugular foramen, so which emerges through the posterior part of the norma basalis, and this transmits the 9th, 10th and 11th cranial nerves and the internal jugular vein. So behind this foramen magnum, so here we can appreciate the internal occipital crest, internal occipital protuberance. So this internal occipital crest, it divides it to form a small triangular depression called as the Vermian fossa. So we see the lateral part. So here is the posterior surface of the petrous part of the temporal bone. In this upper border, there will be situation of the superior petrosal sinus. So here will be the inferior petrosal sinus, which drains into the internal jugular vein. So over this surface, we can see one small meatus called as the internal acoustic meatus, through which the vestibulocochlear nerve and the facial nerve will pass along with some labyrinthine vessels. So just behind that internal acoustic meatus, we can see a small vertical slit here called as the aqueduct of vestibule, and below that there is a small depression known as the subarcuate fossa. So these are the features that we can appreciate in the posterior surface of petrous part of temporal bone. The remaining area of the occipital surface, so we can see some depressions. So this is called as the transverse sulcus, so which lodges the transverse sinus. So usually the right one is quite larger and it is continuous with the superior sagittal sulcus. If we trace this transverse sulcus, it passes at the junction of the petrous and the occipital bone, and this sigma shaped sulcus here, it is known as the sigmoid sulcus, which lodges the sigmoid sinus. So that sigmoid sinus, it exits through the jugular foramen as internal jugular vein. These are the major features in the posterior cranial fossa. So this is the sloping clivus found by the basi-sphenoid and the basi-occiput, and at this junction between the clivus and the petrous part of the temporal bone lodges the inferior petrosal sinus, foramen magnum, the Vermian fossa, internal occipital crest, internal occipital protuberance. The internal occipital crest, it provides attachment to the falx cerebelli. Here is the transverse sulcus, which continues as the sigmoid sulcus. They contain the dural venous sinuses of the same name, and the posterior part of the petrous part of temporal bone, we can appreciate that internal acoustic meatus, a vertical slit called as the aqueduct of vestibule, and the depression there appears as a shadow in this, so that is the subarcuate fossa. So these are the major features of interior of the skull or the cranial cavity. Do subscribe for future updates. Thank you.